Hi, everyone, and welcome to today's webinar. Today we'll be talking about sleep health and looking forward to discussing this with everyone today. So a little bit about who we are. We are the Healthy Libraries program. The Healthy Libraries program is a partnership with the Public Libraries of Suffolk County, the Suffolk County Cooperative Library System Outreach Services Department, and is supported in part by the American Heart Association of Long Island. This program is an interdisciplinary team of public health, nursing, and social work students whose aim is to provide evidence-based health information, screening, and case management to a diverse community of patrons in the public library setting. We work to refer patrons to promote access to appropriate health and social services programs locally throughout Suffolk County that will address their health and social support needs. And for students, we work to experience interprofessional team and demonstrate the core competencies based on the Interprofessional Education Collaborative. A little further about who we are. We have some great student leaders with us. Some today. We have Gwyneth Mersep, who's undergraduate student, Bachelor's of Health Science. Philip Massaro, myself, undergraduate student in the School of Nursing. Wendy Los Santos, undergraduate student in social work. Christine Weber, a graduate student in social work. We have Dr. Lisa Ben Scott, professor and director of the program in public health. Dr. Mariana Lasala, chair of the Department of Undergraduate Studies in the School of Nursing. Dr. Denise Snow, clinical professor, School of Nursing. Leah Topek Walker, social work and field education coordinator in the School of Social Welfare. Jessica Kuz, who is our library science in the School of Medicine in the program Public Health and Biomedical Informatics. And Gabriella Pendofelli, who's a graduate student and our program director in the Masters of Public Health. And I will hand it off to our nursing students who'll be presenting today.
Hi, I'm Carly. I'm one of the presenters. Our names are Sarah, Sonia, and Carly, and we're all senior nursing students at Stony Brook University. Some fun facts about us before we start. I'm Carly, I'm 23 years old. I'm from Wantagh, and I have 3 dogs.
Hi guys, I'm Sarah. I'm 23 years old. I live in Babylon and I'm a twin.
Hi guys, I'm Sonia. I'm 23 years old and I'm from Brooklyn, New York, and I have 1 cat.
Objectives with this webinar today on sleep health. By the end of the webinar, we hope that everyone who's participating today will be able to explain the importance of sleep health, identify different sleep disorders, identify risks, signs, and symptoms of different sleep disorders, identify treatments and therapies for sleep disorders, explain how sleep affects health, and identify good sleeping habits. We ask that everyone here today for the webinar, please put yourself on mute. We encourage everyone to participate throughout the webinar. If you do have a question, please enter the question into the chat box and we'll work to answer your question. At the end of the presentation, we'll have time for questions. All right, I'll hand it off to the nursing students who will continue with the webinar.
So sleep is essential to a healthy life. Here are just some questions we want you guys thinking about while we do the presentation. First one is, what do you think is the longest time anyone has ever went without sleep? The next one is, how much of their lifetime do humans spend sleeping? And do people only dream in color? So some sleep statistics are, according to the CDC, 35% of adults are not getting enough sleep. The average teenager gets 6.5 hours of sleep, 20% only getting less than 5 hours of sleep a night. 50 to 70 million US adults are reported to have a sleep disorder. Insomnia is the most common sleep disorder, with 30% of adults having short-term insomnia and 10% of adults having chronic insomnia. 25 million have obstructive sleep apnea. 1.3% of adults use melatonin, and only 66% of CPAP users are adherent to therapy. So I just want to explain, CPAP is basically a machine people use to help them breathe at night. And according to these statistics that we found, only 66% of users are actually adherent to it. So why is sleep important? So adequate sleep protects our mental and physical health. During sleep, our brain builds new pathways to help us learn and retain information. So without sleep, we can struggle with controlling our emotions and making proper decisions. Sleep helps heal and repair our blood vessels and heart. So lack of sleep can actually contribute to heart disease, high blood pressure, diabetes, and stroke. Sleep helps balance our hunger. Ghrelin and leptin are hormones that make us feel hungry, and with proper sleep, our hormones are balanced so you do not feel as hungry. So some myths on sleep. So snoring is not harmful. That's a major myth. But in reality, snoring can be a sign of sleep apnea, which is something we will discuss in a little bit actually. The next myth is you can catch up on lost sleep. So everyone basically believes this. The truth is you can't ever catch up on lost sleep. It only adds to the amount of sleep that you've already lost. And we need less sleep as we age. The truth is the amount of sleep we need as we age does not usually change. It's just our sleep habits and sleep patterns that do. So some sleep disorders. So sleep deprivation is a condition characterized by a lack of sleep, not sleeping well, sleeping at the wrong time, or a sleep disorder. Your internal clock determines when you're awake and ready to sleep, aka your circadian rhythm. Sleep deprivation can lead to trouble focusing, learning, and leave you tired all day long. Some risk factors include illness, people older than 65 years of age, due to medications that they're on, and stress. So insomnia. Insomnia is the most common sleep disorder characterized by trouble falling asleep or staying asleep despite having ample time to sleep. So even though you have so much time to sleep, you still aren't able to. Insomnia can have serious effects on your life. It can affect your work performance, your relationships, and your decision making. So every aspect of life almost. It can be caused by stress, poor sleeping habits, your daily schedule or routine. Most common in older adults, women, people with pre-existing medical and mental conditions, and people who are stressed. So I just wanted to expand just a little bit on women. It's most common in women. So around the menopausal time, insomnia is the most common sleep disorder that women have. And this is actually due to the decrease in our hormones, so estrogen. The decrease in estrogen, it's harder for many people to fall asleep and does change up a lot of aspects in their body. So there are two types of insomnia. Short-term insomnia is brief insomnia, which lasts for less than 3 months. It can be caused by a stressful event. And chronic insomnia is a long-term insomnia that lasts for 3 months or longer and at least 3 nights per week. It can be caused by stress as well, irregular sleep schedules, mental health, and other sleep disorders. Some signs and symptoms include waking up during the night, not feeling well rested, irritability, depression, and anxiety, and daytime tiredness or sleepiness.
Another sleep disorder is sleep apnea. Sleep apnea is a disorder in which breathing periodically stops and starts throughout the night. This is due to the airway repeatedly becoming blocked, limiting the amount of air that reaches the lungs. There are two types of sleep apnea: obstructive sleep apnea, which is the most common, and central sleep apnea. Obstructive sleep apnea occurs when the muscles in the back of your throat relax, and when those muscles relax, your airway narrows or even closes as you breathe in. The mechanism behind this is because the less air you get in, the oxygen level is lower in your blood, and then your brain is able to sense this inability to sustain a proper oxygen level, so then your brain will wake you up so you can reopen your airway. This awakening is usually brief, and it can repeat itself 5 to 30 times or more in each hour all night long. Some risk factors are obesity, gender, so it's more common in males, family history, tobacco and alcohol use, older age, and other medical conditions like heart failure, high blood pressure, diabetes, Parkinson's, and hypertension. Central sleep apnea occurs when your brain fails to transmit signals to your body to breathe. So the mechanism behind this is that there's no signals from your brain to tell you to make an effort to breathe for a short period of time. You might awaken with a shortness of breath or have a difficult time getting to sleep or staying asleep. Some risk factors are old age, gender, again, more common in males, heart failure, hypertension, stroke, or use of narcotic pain medications. Some signs and symptoms of sleep apnea are loud snoring, episodes in which you stop breathing during sleep, gasping for air while you sleep, which is usually reported by your partner, awakening with a dry mouth, wake up with a morning headache, you have difficulty staying asleep, you have excessive daytime sleepiness, you have difficulty paying attention while awake, and irritability. Another sleep disorder is narcolepsy. Narcolepsy is a lifelong sleep disorder that causes overwhelming daytime drowsiness and in severe cases have sudden uncontrollable sleep attacks. The cause of this is unknown, but there's two types. Type 1 is type 1 cataplexy or low absence CSF hypocretin 1 levels, and then type 2, which is usually referred to narcolepsy without cataplexy. Type 1 is narcolepsy with cataplexy. Cataplexy is a sudden loss in muscle tone that occurs during waking hours. This is due to the extreme low levels of naturally occurring chemical hypocretin, which promotes wakefulness and regulates REM sleep. It can cause muscle limpness, which might make you feel like you're going to collapse. It can also cause involuntary muscle movements, but this is rare. Most people are at risk for cataplexy after experiencing a strong emotional response, such as excitement, stress, or fear. Some symptoms of type 1 narcolepsy is cataplexy, sleep paralysis, hallucinations, and insomnia. Type 2 is narcolepsy without cataplexy. This condition causes excessive daytime sleepiness, but you don't experience any muscle weakness. And also the symptoms are less severe. The hypocretin levels are usually normal in these people. And some symptoms are excessive daytime sleepiness, sleep paralysis, insomnia, and hallucinations. Some treatment and therapies. So treatment and therapy for sleep deprivation, there's two types, so medical and non-medical. Medical treatments are sleeping pills, medications that for the underlying health issues that lead to sleep deprivation, melatonin supplements, surgery or breathing devices, specifically in cases of sleep apnea. And then non-medical treatments are relaxation training, stimulus control therapy, and cognitive behavioral therapy. Treatment and therapy for insomnia. Some medical treatments are sleeping pills like Lunesta and Ambien. Some non-medical treatments are cognitive behavioral therapy, stimulus control therapy, relaxation techniques, light therapy, and lifestyle changes like quitting smoking, limiting your alcohol and caffeine intake, and avoiding taking naps. Treatment for sleep apnea. When usually there's mild cases, the doctors usually tell the patients for lifestyle changes like to quit smoking and weight loss, but if those don't help, they have other therapies like the CPAP machine, BiPAP, and supplemental oxygen. Then there's also surgeries. These are a bit extreme, but these are options that they laid out, which are tissue shrinkage, jaw repositioning, implants, nerve stimulation, and tracheostomy, which is creating a new air passageway. Treatment and therapy for narcolepsy. There's no cure, but there are some therapies like lifestyle changes, which is just maintain a regular sleep schedule, avoid caffeine or alcohol, and large heavy meals before bed, avoid smoking, exercise daily, relax before bed, and use safety precautions. Like if you're experiencing any symptoms, don't drive or use any heavy machinery. Medical treatment is modafinilin, which is a CNS stimulant, Ritalin, which is an amphetamine-like stimulant, antidepressants, and SSRIs and SNRIs.
Okay, so since we discussed a bunch of different sleep disorders, let's actually talk about the effects of sleep on health, particularly the negative effects of sleep on health. So what can happen to our bodies if we don't get enough sleep? So these are the bullet points that I'll be discussing in greater detail, but this slide just goes over what I'll be discussing. So 1, you can get sick, your risk of cancer increases, Your risk of diabetes increases, your ability to concentrate and think will be greatly diminished, your memory becomes impaired, you become more accident prone, and your libido decreases. Okay, so number one, sleep and immunity. So according to research, sleep deprivation increases one's chances of getting sick after being exposed to a virus, such as those that cause the flu and the common cold, and of course now we're thinking about COVID-19. So why is that? When we sleep, our immune system releases what is known as cytokines. And some of these cytokines serve to help us sleep, but others play a key role in immunity. So that when we encounter a foreign body, such as a virus, our body naturally releases these cytokines to perpetuate this inflammatory response and to mediate the immune response. So you can imagine that if we lack sleep, we produce less of these cytokines, and thus when we do encounter these foreign pathogens, such as viruses, we have fewer so-called soldiers or cytokines to help us fight those when we do encounter them. And also, infection-fighting antibodies in cells are reduced during periods that we don't get enough sleep. So the link between sleep and cancer, according to research conducted by Johns Hopkins, there actually is a correlation between sleep deprivation and an increased risk of breast cancer, colon, ovarian, and prostate cancer. And this is thought to be due to a disruption in the body's natural biological clock. And so I included an actual study in the International Journal of Cancer that found a relationship between women's work schedules and an increased incidence of breast cancer. So between 2005 and 2008, they included 1,300 women who did not have a cancer diagnosis, and they compared it to 1,200 who did. And what they found was that women who worked at least 4 years on night shift work, for example, actually had the highest risk of developing cancer. So yay for us nursing students who will be working night shift. And they found that overall women who worked specific shifts had an actual 30% increase in cancer rates. So let's talk about the link between sleep and diabetes. So with perpetual sleep deprivation, our body naturally produces less insulin upon eating. Insulin is needed to allow glucose to enter cells from the bloodstream for energy utilization. So as less insulin is released, more of that glucose is going to remain in the bloodstream and contribute to high blood sugar levels. When you're in your awakened state, the body naturally produces more cortisol. Cortisol is a hormone that's secreted from your adrenal cortex, and one of its functions is to keep us awake and keep us alert. Cortisol, again, naturally releases blood sugar, while at the same time, it also renders your cells less sensitive to the insulin that your body produces. And so both of these factors combined are going to increase your blood sugar. And then the last aspect of that is when we're awake, we naturally eat more. So of course, when you eat alone can raise blood sugar levels, but those who can't sleep, whether it's due to insomnia or another sleep disorder that we discussed earlier, those who can't sleep are more likely to stay awake and eat. And of course, that will increase your chances of becoming obese, which is the leading determinant of acquiring type 2 diabetes. So sleep and cognition, this is something that we all probably can relate to a little bit. So why is it so stressed that we get a good night's sleep before a big test, a job interview, a big performance, etc.? And the answer is because sleep has a direct effect on cognition. When we sleep, memories are reactivated. We have connections between our brain cells that are strengthened, and short-term information is transferred to long-term memory while we're sleeping. Our brains, despite what you may think, actually remain highly active when we sleep. And recent findings suggest that sleep plays a key role in eliminating the toxins that build up in our brains throughout our awakened state during the day. And a lack of sleep simply slows reaction time as well, which is why you're advised not to drive when you've had a lack of sleep. Just go back one slide, Phil. Okay, so sleep and libido. Lack of sleep is directly correlated with decreased libido, and this is due to the hormonal shifts that Sonia touched on a little bit with prolonged periods without sleep. As periods of the awakened state lengthen, our brains signal less secretion of estrogen and testosterone in favor of that increased cortisol secretion that I touched on a few slides back. And so I included just a single study and conducted 2016 by Rodriguez, who reported a 14% increase in sexual arousal in women who had longer sleep cycles. And then, of course, you want to know the link between sleep and COVID-19. So according to research at the University of Warwick, they found that a diagnosis of sleep apnea actually is associated with an increased risk of adverse outcomes with COVID-19. And then, as I mentioned in that first slide about immunity, sleep improves immune function. So it's so important now more than ever that we make sure that we get enough sleep. So let's discuss some fun facts. Okay, so some fun facts about sleep. And so these were some questions that we asked you guys to think about in the beginning of the presentation. So here are some answers. The longest that someone has ever gone without sleep is actually 11 days and 25 minutes. 12% of people dream entirely in black and white. And before color television, only 15% of people dreamed in color. Humans spend a third of their life asleep. And I think this one is really cool. Sleep experts have discovered a direct link between sleeping, your sleeping position, and your personality. And humans are the only mammals that we know of that willingly delay sleep.
After hearing all of our chat about other like sleep disorders, now let's practice some good sleeping habits. Some good sleep habits are to stick to a sleep schedule, going to bed and waking up at the same time every day. Avoid watching TV or being on your computer an hour before you go to sleep. And the use of blue lights around bedtime is linked to suppression of melatonin, shifts in circadian rhythm, and other serious health issues. So due to that, try to use dim red lights instead of blue lights at night, because red light is less likely to suppress melatonin and affect one's circadian rhythm. Also try to avoid looking at bright screens like your phone, beginning 2 to 3 hours before bed. Try and keep your bedroom cool and dark. Discover relaxation techniques such as a warm bath before going to bed. Do not eat large or heavy meals before sleep, and avoid caffeine and nicotine, as both are stimulants which can disturb your sleep schedule.
All right, thank you, everyone. So on the slide here, you'll see a few of our helpline resources. As always, if you are in immediate crisis or need help as an emergency, absolutely call 911. Here are links for Disaster Distress Helpline, the National Suicide Prevention Lifeline, National Domestic Violence Hotline, National Child Abuse Hotline, National Sexual Assault Hotline, and the Suicide Prevention Lifeline. Here you'll find a few of our local helpline resources. We have the Response Hotline, the Talbot's House, which is a 24-hour substance abuse crisis hotline, Adult and Child Protective Services, the Long Island Crisis Center, 516-679-1111, the Suffolk County Department of Social Services and Emergency Services, and Sagamore Children's Crisis Respite House and Suffolk Crisis Respite House Bed Network. And some resources for the HELP program, the Stony Brook Medicine Healthy Libraries program, also known as HELP. If you'd like to reach out to us, our information's here. For our email, it's healthy_libraries_program@stonybrookmedicine.edu. You can give us a call at 631-216-8220. And here we'll link our website, Facebook, and YouTube. And be sure to check out our YouTube and Facebook pages for previous programs that we've done. We record all our programs so you guys can find them online on YouTube and watch them at your own convenience.